I am Dr. Thompson, Akwo, Ntuba, international physician, certified professional and expert in global health USA, subspecialized in global health communication and promotion. The 75th World Health Assembly 2022 May will run from the 22nd of May to the 28th of May 2022. And the work of the member states represented by their ministers and or secretaries of the departments of health. The 194 member states, partners, international organizations, non-profits who have an observer status at the World Health Organization General Assembly, or the WA, will be meeting in Geneva, Switzerland. And as is the custom of the governing body of the World Health Organization, the World Health Assembly is the major policy body of the World Health Organization. Here, ministers and secretaries of the health departments or ministries of health and of public health of the different nations who make up the member state come together in a general assembly to take decisions, to vote and approve the budget and the working documents, to elect and approve a Director General for the world body. This year, Dr. Tedros, who has been running the organization for the past 5 years, will be presented as a Director General candidate unopposed. And if re-elected or approved by the World Health Assembly, he will then be given his second and last term of 5 years Tedros' first 5 years has to do with the triple billion vision he presented to the General Assembly after our colleague Dr. Shah left the organization. But COVID-19 came in 2 years ago and almost became the defining project of his first term of office. The World Health Assembly meets in the Palace of the Nations in Geneva with delegates coming from all the continents and from all the 194 member states to meet physically in an assembly. During the assembly, there are two major committees, Committee A and Committee B, working committees, through which certain discussions on the issues and decisions and the guiding documents and deliberations are made. There is a president of the World Assembly who is elected to lead the assembly, assisted by vice presidents elected from member states. During the World Health Assembly, they are invited presidents, prime ministers who show interest in particular subject matters which the assembly discusses. During this 2022 war, a lot of discussions will be centered around the high-level meeting related to non-communicable diseases, or what we call in global health, chronic diseases, be they chronic obstructive lung diseases, diabetes, cardiovascular accidents and strokes, and the others. We know that the major functions of the World Health Organization is to promote health globally, work towards safety, and to address problems of the vulnerable. The World Health Organization gives technical assistance and support to member states through the WHO offices and representatives in member states. WHO also does a lot of work directly where there is epidemics and emergencies, humanitarian disasters. During the World Health Assembly, as will happen this 2022 May, from the 22nd, the World Health Assembly will also elect 10 new members who are scientists from the member states to replenish executive board, because every year 10 members of the 34 member executive board will come to the end of their 3-year term mandates, making room for other 10 new members from member states to be elected into the executive board of the World Health Assembly. The WHO this year will be looking at substance use disorders and drugs of abuse, related things, infectious diseases, poliomyelitis, non-communicable diseases, mental health, and related problems, which are addressed to bring about the outcomes of promotion, safety, and care of the vulnerable. There will be a report from the Director General, Dr. Tedros, and especially this 2022, we, the Global Health experts will be looking at the report and want to see keenly what is there that shows achievement vis-a-vis his campaign manifesto 5 years ago. COVID-19 will appear in the speeches, some of which will be done by presidents of member states. Overall, the ministers of member countries' health departments and or ministries will be deliberating on the different health issues that will preoccupy the assembly this 2022. There is no doubt that the WHO continues to be very useful and fruitful to the global health community. Recently, there have been new players from the 21st century who are in global health: the World Bank, the Population Health and Nutrition Program of the World Bank, and the World 75 or the 75th World Health Assembly will come after the Global Summit on COVID-19, which is organized and chaired by United States and co-chairs Germany for the G7 nations as the president, Indonesia as head of G20, Senegal as chair of the African Union, and the other co-chairs. The global health security and the international health regulation frameworks and conventions will be looked into, and some of those discussions brought into the WA by ministers of these governments who will be participating tomorrow, the 12th, Thursday, 2022 May, in the Global COVID-19 Conference. There is still much work to be done. COVID-19 has undermined some of the gains which the world has made in the prevention and control of many diseases and conditions which create morbidity and mortality around the world. That notwithstanding, there is need for the world to balance its preparedness and responses to these emergencies, these disasters, these pandemics, and these problems and disasters that the world is dealing with, climate change and related issues. So, the predominant item on the agenda happens to be, as it seems, non-communicable diseases or chronic diseases. And most of the discussions will center around the high-level meeting on non-communicable diseases, decisions, guidance, directives, which the body has put together for member states, besides the other issues which will be discussed. So, going to WAS 75, some of the things to look out are: one, the possible re-election of the President Director General Dr. Gabriel Tedros. The election of 10 new members from member states to join the other 24 to make 34 health scientists from these member states who are elected into the executive board. The executive board is committed in running and executing the decisions of the member states, the policy of the member states that come from the World Health Assembly, which is the policy making body of the World Health Organization. And the executive board executes this decision working with the Director General and the staff of the World Health Organization. They will also, as a body, look into issues which are related to financing, the WHO pension work, and other things. So, it's not the first World Health Assembly, it's the 75th. And at the time when it looks like COVID-19 is beginning to move from the acute phase to another phase, the world will be having an opportunity to address other challenging problems. So, we are aware that the World Health Organization looks at communicable diseases, and a lot of successes have been made before: eradication of polio and other infectious diseases. They are working on presently on Ebola. They work on HIV/AIDS, and then COVID-19 that we all have been working with. For the past 2 years, we've been having constant meetings with the Director General, Dr. Tedros, the bi-weekly meetings, and we've had those resources sent to us, and a lot of them have been worked on and given to the public for consumption. So, as the delegates, as the ministers come to WAS 75, we want to especially thank all those countries that have been committed and making sure that the required percentage of their national budgets go to the health sector, and that they found within their political will to have healthcare experts of high integrity and honesty to run the programs and projects for which the monies have been allocated. We know that there is a lot of corruption in many middle and low income countries, which have a way of hindering the outcome of the national policies which are put in place to address many of these communicable and non-communicable diseases epidemics, pandemics, and disasters. So the WHO will be holding the WA, or the World Health Assembly 75 out of Geneva. And people are called to contribute